Hello, everyone, and welcome. Thank you for joining us. Um, I'm Rachel Fasani. I'm with the Missouri Rural Health Association. Welcome to our first webinar, first in a series. Hopefully, we don't have any technical issues, but I think we're off to a good start. If you need anything at all, feel free to chat me in directly or drop any questions you have for the whole group, and I'll make sure that those get addressed. I also wanted to let everyone know that we have quite a few events coming up that you should be able to access on our website. Our next event is an Ask the Expert starting next week on our virtual platform called MRHA Connect. And then on May 1st, we have another Lunch and Learn webinar. So we would love to see you again for any of those. This event is also going to be recorded and posted on MRHA Connect. So if there's anything you want to revisit after the fact or share with any of your colleagues, we will get that up there as soon as we can. And with that, I will pass it off to Misty. We have today Misty Snodgrass, and she's coming to us from Attain Health. And we really appreciate you being with us and for kicking off this series. Thank you.
Yeah, thanks so much for having me. And, it's always a good lunch and learn when you're going to talk about food. So hopefully you guys are getting healthy, nutrient dense food while we chat. And then look forward to any questions you may have. And then I will go eat my lunch after this call. So just a little bit about myself. I'm Misty Snodgrass. I'm SVP of Growth and Healthcare Strategy. I know I recognize lots of names that I've worked with in prior lives. So I'm located here in Kansas City, but I've done a lot of work in health advocacy, rural health, community mental health, and several other things as well. So look forward to the conversation today. Feel free to put anything in the chat. I may not be able to see it, but Rachel's going to help me, and we're going to get started. So just going to kind of go over some of the objectives for this call. It's just because there's a lot of things with food as medicine. And so we try to tailor it to be very meaningful and intentional for you guys. And so if you have any other questions, like I said, this topic can go deep and you can have an entire day's worth of presentation, but we're just going to give you a little snippet. And then I'm happy to follow up after the call or in the question and answer later on today. And so what we're going to talk about today is the importance of personalized nutrition care, the importance of data-driven insights for this transformative opportunity that exists out here at the intersection of health and wellness. Also, there's a lot of public policy going on, so I'll give you a little snippet. I'm tracking it for the whole country, so happy to answer or give any examples throughout the country that are interesting as well, if that's an area of interest. And then how rural is a little bit different from an urban area in this space. So look forward to the conversation. Going to talk to you about some of the things that are out there that are kind of being tried and tested all around the country, and then things that you guys can use in your local community as well that can be beneficial. We see a lot of federally qualified health centers, health systems starting to really engage into the space, even ahead of health plans. So look forward to the conversation and happy to carry the conversation on afterwards. We're going to talk about maternal health specifically, but this can be applicable to other chronic conditions. And I will hit on that a little bit because, as you know, maternal health, often the, disparities that occur in health conditions are, preeclampsia, hypertension that we see with traditional chronic conditions. And then also the importance of personalized approaches, how important it is. Food is how we celebrate. It's how we grieve. It's how we spend time with friends and family. And so it has to be personalized. It can't be a one size fits all solution for everyone, or it will not be successful. And then we'll also dig deep into the importance of empathy and cultural competence and appropriateness, and then how data is really driving this work. So I'm going to go to the problem. I'm sure most of you are deeply aware of the issues, so I won't spend a ton of time, but I do think it is really important to level set and to kind of highlight the issues that are really driving this issue. And so just broadly speaking, 133 million Americans are living with a chronic condition. So essentially that's about 40%. And then, as you guys know, healthcare costs are continuing to rise. And then families are facing food insecurity, diet related diseases at higher rates than ever before. And as you guys know, just going to the grocery shop every week or monthly or whatever you choose to do, it really is becoming financially impactful. Trying to even just purchase groceries, let alone the nutrient dense, which are oftentimes more expensive. So this is just a tree that I love to share because I think it's really important that it gets to all of the issues that are kind of impacted. And we all know it, but it's really, I think, important to look at it. So I always go to the root causes. And there are numerous causes related to health, everything from racism, poverty, health literacy, access to affordable and safe housing, access to healthy and nutrient dense foods, adverse childhood experiences, lack of nutrition education that occurs in our schools, and as well as just in the doctor's office and clinicians, and it's just due to lack of time, right? There's so many things going on with an individual, you can't really be able to highlight on the needs that are occurring for nutrient as much as you want to. And then I think one that doesn't get a lot of chatter around the root causes of health, but there's been a significant disinvestment of grocery stores, particularly adversely in rural areas, but also in some urban centers as well. And there are economics related to that. So if they can't meet their, grocery stores operate on a very lean margin. And if they can't meet their margins, they have to unfortunately close up, and that impacts access. And then also there's social drivers of health. So everything from education, again, adverse childhood experiences, education, housing, social environment, the built environment, whether or not you have soft sidewalks, whether you not have dogs roaming around and you're not able to go out and have nice walks, lack of support and employment. And then there's behaviors, right? So there's smoking, there's social isolation, substance use, stress, lack of exercise and diet. And then there's these all lead to the health outcomes, which are the leaves of the tree. So depression, hypertension, heart disease, diabetes, obesity, cancers, and substance use. So there are significant challenges for anyone when it comes to chronic conditions, but there is definitely an adverse impact for individuals that are typically on Medicaid. And this focus is going to be on maternal health. 50% around the country of all births are on Medicaid. And in Missouri, it's about 40, a little over 40%. And so there are financial challenges to be able to afford that. As we mentioned earlier, the cost of groceries, the ability to not have transportation that is reliable to get to the grocery store, and then nutritious foods can be harder to afford than all the items in the grocery store. We're taught to eat on the outside of the grocery store. However, it can be really hard to do that and challenging, and we see that in everybody that we serve, to be able to afford those healthier foods. And then there's barriers to access to food. So there's, like I mentioned, grocery stores, transportation challenges. There may not be a farmer's market. And in some communities, we love the work that food banks do. We partner with food banks and food pantries, but they may not be able to get there all the time. We work with a lot of, community providers in rural areas, and they really struggle to get consistent, healthy, nutritious foods. And it's just because of capacity, charitable funding, all of those things impact that. And then there's unfortunately a reliance on unhealthy alternatives like convenience stores and fast foods due to factors such as limited grocery store access, whether it be a food desert or prevalence of unhealthy food options, which are called food swamps, and an inadequate investment in healthier choices within community. And I can speak from personal experience. I grew up in a rural community, and my mom had to drive. We did not have very reliable transportation, but was able to drive about 30 minutes to when she worked at a convenience store. And so that was where we got a lot of our food, was, leftover things that were about to expire from a convenience store, for many years whenever my family was facing financial challenges. So these challenges are real and they can have lifelong impact. And so it impacts you on your ability to do healthcare and wellness now, but it also has long-term impact for the future as well, and can lead to long health conditions. I'm going to go a little deeper here on some of the challenges of food insecurity in rural areas. Every area and every community is different, so I don't want to try to paint a broad brush, but I do want to highlight some of the things that are we see as common trends in rural areas. As I mentioned, limited access, that can be the main linchpin. The ability to get those fresh fruits and vegetables consistently and that they're available and affordable. And then there's transportation challenges I mentioned, financial constraints, as well as there may be a limited selection. If you go to a grocery store in a rural area, you're going to find different availability than you may be able to find here in Kansas City in a suburban supermarket. And so that impacts affordability and food variety. And then we know it's clear the science is there, the research is there, that food insecurity in rural areas is strongly associated with chronic diseases and other poor health outcomes, which continuously exacerbate existing health conditions and disparities. And then there's limited infrastructure and smaller population bases in rural areas, which contribute to lack of access to nutritious foods. Rural America has a lot of stuff going for it, but these are some of the challenges that we see and experience in rural communities that I'm sure you guys are facing every single day. So we're going to go drill down a little bit on the maternal health because that is of great interest. And it's really emerging in the food as medicine space around maternal health. There's been a lot of work around diabetes, but nothing as deep as there is around maternal health. And I'll kind of go in and give some experiences that we're having with some of our maternal health projects that we have going on. And some of you may already know this, but there's a sharp increase in the US and in Missouri related to pregnancy complication, mortality, and morbidity. 3 times the Black women living in Missouri are more likely to die within 1 year of pregnancy than white women. As you can see, that's a significant disparity. Women on Medicaid in the state of Missouri are 10 times more likely to die within 1 year of pregnancy than those with private insurance. So you can see the financial impact and the disparity is even more significant for those that are on Medicaid, which we know is about 40% of births in the state of Missouri. And then 40.4% of women who gave birth in Missouri had one or more chronic health condition, such as hypertension or obesity. And that is significantly higher than the national average. The great news is we know that nutrition interventions can make a difference and have an impact in numerous ways. So now that we talked about all the negative, we're going to talk about the positive and what we can do. So Medicaid's role in maternal health can't be understated, and we can't miss it with so many births occurring with Medicaid as the payer. And it is crucial for providing access to health care. It's the largest source of healthcare coverage for pregnant women in the US, and utilization is higher in rural areas and among specific demographics. Historically, as many of you may know, that many women lost their Medicaid coverage 60 days postpartum. And now the exciting news is the American Rescue Plan Act of 2021 allows states to extend postpartum coverage for up to a year and potentially longer, which is wonderful. Almost every state in the country has expanded it, and we are seeing already significant impact just by providing coverage after that 60-day postpartum period. So I'm going to go take a step back and kind of go over what is food as medicine, because like I said, it has lots of connotation, lots of theories. So this is kind of the like understood, representative of what most people believe food as medicine is. So at the bottom, you can see at the pyramid is population-wide and federal and state food policies. So that can be a whole host of different things. That could be, limiting sweetened beverages in schools. There's a whole host of things going on in communities. I won't talk about that. That's just kind of general things related to food as medicine. There's a lot of patient advocacy organizations such as the American Heart Association, American Cancer Society that are doing that work. But it is really important work to help set the playing field. And then there's some other programs that you're probably very familiar with. Federal food programs such as WIC, SNAP, and school lunches, which are wonderful programs and serve as a baseline. And some cases people think do enough. I think that they're great, but they don't, supply for the whole month. For example, we see a lot of our individuals that are, recipient of these kind of traditional food programs, and they may not purchase from our food platform early in the month, but towards the end, they're running out of their benefits and really want to have access to healthy and nutritious foods to feed their families. Produce prescription programs are fantastic. And there's a lot of rural communities doing this. There's, everything from double up food books in some communities. There's the GusNet program where you can actually utilize your government benefits for WIC and SNAP and let them go further. And they are a fantastic program. We participate in many produce prescription programs, and they do wonderful work to get produce, fruit, and vegetables into the hands of families that want them. And a lot of folks will say, "Oh, well, maybe people just don't want to eat healthy, nutritious foods." Whenever we've seen them access our platform, we by far see by far and away the number one item that individuals purchase is actually our fruit and vegetable box every month. And it's one of our more expensive items, but individuals are wanting to have that shipped to them. It is by far the number thing. The other interesting thing, just while we're on that topic, our second item, whenever you're working in food as medicine that a lot of people don't talk about, is having access to the appropriate items to store food and to cook food. So the number two item on our platform is actually food storage. So people are making healthy, nutritious meals, but don't have a place to store them. So that is one of the things that we see a lot of individuals purchasing on our platform. The next is medically tailored groceries, which is what my company does. I'm not going to do an infomercial on our company, but just want to let you guys know kind of the services that we provide, where you have healthy, nutritious, nutrient dense foods, where you're able to access that. That is often, curated by a dietitian and supported by oftentimes a health coach. And then there's medically tailored meals. There are only specific instances where medically tailored meals have to be utilized. I mean, they're great for a lot of folks, but they can be very expensive, and then they can also may not be able to have all the benefits for general nutrition that someone may be having. So you typically see this with individuals post-hospital discharge, individuals that have diabetes that are not in range, individuals with hypertension that is not controlled. But these are all kind of steps in the food pyramid of medicine, a food is medicine pyramid. And you can see it kind of just grows up and it becomes more and more narrowed for everyone. It's not necessary for everyone to have access to this. As the food is medicine movement is definitely growing, there's growing interest due to high cost and health issues related to poor nutrition. Nutrition related health issues cost the US economy 1.1 trillion annually. And then there are programs that are designed in these food as medicine programs to treat these diet related diseases or even better prevent them. We're seeing a lot of interest related to individuals with prediabetes. Also seeing a lot of interest related to individuals, and organizations and health plans that are wanting to actually cover it for individuals with obesity as a precursor to a GLP-1 or as a maintenance whenever someone is coming off a GLP-1 or while they're on their GLP-1, just to be able to provide that nutrition support, access, and kind of coaching or counseling that may be needed to be able to contain those strides that they've been able to make, and improve them further down the road. Nutrition and overall health, like I can't say this enough. 100%, if you've ever had any sort of health condition, it is very closely linked to overall health. And just think about it. If we don't eat well, we probably don't feel as well. Maternal health outcomes and chronic diseases such as obesity, diabetes, hypertension, and cardiovascular disease, and even certain cancers are absolutely impacted by our diet. So lifestyle interventions such as diet and exercise are as effective as medications in managing these conditions oftentimes. We see a lot of our pregnant women who are not getting the proper hydration or are fearful of physical activity. And so it's really important as you're working with individuals to help provide them the guidance, what they should be doing related to nutrition and also physical activity and hydration. Despite the benefits, many struggle to obtain their daily servings of fresh fruits and vegetables. We see this every single day in our data. Oftentimes it's access, it's cost. And then some of the unique stuff that we see, especially in our kind of underserved populations, our maternal health populations, our Medicaid populations, is a lot of individuals actually don't know how to cook or how to store or what they can add to actually make their vegetables taste better, and how to prepare them. And so it's really important as part of a nutrition program, if you have anything going on, is to really take a step back. We do everything at a fourth grade reading level so that it's very understood. and just how to serve, how to prepare, how to store those nutritious foods and nutrient dense foods that you want. Because, if you haven't had access to them, you're not going to know how to prepare them or how to prepare them. And we see a lot of individuals who are reluctant to try new fruits and vegetables because they don't want to spend their money on things that they may not be able to eat or not like. And so this also gives people the choice as well as the ability to expand their palate and try new fruits and vegetables at not as an impact to them. And so there's ways you can do that. There's programs out there. More and more health plans, more and more health systems are starting to do this work. And so it's really important. And it's really important that, you start to talk about fruit and vegetable intake with your individuals. If they're experiencing obesity or chronic conditions, it's really important to say, hey, how many fruits and vegetables are you getting? Are there barriers? And then start to really identify those barriers. As I mentioned earlier, there can be financial, geographic, lack of health literacy is a really big issue. Time, skills, or equipment for cooking and storage, as I mentioned earlier. There's a lot of platforms out there. There's even free apps on how to cook and document and, track your food. So it's really important to just kind of start to have these conversations with the individuals that you're serving so that you can make sure that they're, having access, through different programs that are out there, as well as be able to answer questions related to adequate nutrition. Also, social support is really important. It's really a tough time when people are at that milestone of really wanting to make a change related to their food and their diet. It's really, it can be 2 steps forward and 5 steps back. And so it's just really important to make sure that they're feeling supported, that you're answering any questions they may have. As I mentioned, there can be transportation barriers and then access barriers as well. And so, why does it work? Enhancing dietary and behavior change. And, there's a lot of things that can go and layer into that. It's really important to have food and access. But there is an element of behavior change that has to go on here. So it can be something with health coaches or dietitians in your health system. But combining both healthy food and health coaching or access to dietitians actually creates a comprehensive strategy. So it's one thing to provide access, and that's something that we tend to do is we actually provide access first, build that trust with the population that we're serving, which is typically oftentimes underserved government, sponsored programs. So Medicaid, Medicare Advantage, Marketplace, members, and we provide them education and awareness. And so that's the first step, is just kind of educating. There's lots of things. If they're not using our solution, there's also free things out there. There's personalization, there's long-term behavior change that has to go on, and it's continuous support. And then it's also some accountability, so it's really setting goals. It's really identifying where they want to work on. One FQHC that we worked with that really wanted to do this work. And then they also we had a rural health clinic that wanted to do this work as well. And they, didn't really know to start. And so we really made sure that it was a comprehensive solution where they were driving it and we were just supplying the food and nutrition. And that's really important because you may not have access to food, but you guys have the trust, you have the relationships, you have the knowledge about their health conditions, and can really help to have those early conversations about how food and nutrition can, impact and hopefully, lead them to better health and wellness. Also, there's psychological behaviors going on. There may be, I grew up very food insecure, and it took me a long time because my parents were always like, you got to clean your plate. That may be all, then we may not be able to get as much as, in the next meal or whatever it may be. And so I really had to break a lot of, ingrained behaviors about cleaning my plate. And so, it's really, or, hey, I'm not sure where I'm going to get my next meal and how am I going to be able to afford that, so I'm going to eat what I can. And so there's a lot of psychological behavior, a lot of psychological triggers related to food scarcity and how people choose to eat, and then what foods that they eat. Sometimes they think that the most nutrient dense foods are not as filling as other foods. And so it's just making sure that individuals know what foods can be more fulfilling. And then it's sustainability. That's the key part. Everybody has, different kind of points in their journey through like motivational interviewing where people are willing to where they are, and, meet them where they are and where they are to take the next step. But it's sustaining that behavior over time. And then it has to be holistic. It's really important to provide food access, but if the behavior change component isn't going on, it may not be long term, it may not be sustainable, and it may not have the long term clinical impact. We see in our data, and even the evidence based data that we have seen out in the literature, shows that, and really for these kind of programs to be effective, these food as medicine programs, they have to go for at least 6 months. That's typically the sweet spot for being able to see where outcomes are going to be able to be seen, whether someone is able to lower their A1C or whether they're now actually just monitoring their A1C and giving them that empowerment to do so. I can't tell you, I was just looking at our data for one of our maternal health programs and our diabetes programs, and the amount of individuals that just kind of like it gets so overwhelming in the data and the surveys that we're doing that they're not even checking their blood glucose, and they're not even like going to their doctor because they're fearful of what is going to happen in that doctor's visit. So just know that that anxiety often lies from within someone that has a chronic condition or experiencing kind of a significant health event, whether it be just in a limited time period, whether it be a maternal health situation, and but and then or someone has a lifelong chronic health condition. And interesting, the data just came out, I think it was last week, that showed that pregnant women that have preeclampsia are likely to have significant health conditions for the rest of their life. So this really is a moment in time, and we see our pregnant moms really wanting to do a behavior change. This is like a point of inflection in their healthcare journey, and they really want to be healthy for their moms. They're trying to quit their smoking. They're trying to eat as healthy as possible. They're trying to drink as much water as possible. And, oftentimes just that anxiety can start to build up and not knowing what to do next. And so making sure that individuals feel supported and that it's a holistic approach. The next thing I'm going to talk about is the opportunity in Medicaid, and I think this is really important because as I mentioned earlier, I know that not all, the people you surveyed may be on Medicaid. Some may be on a fee schedule. They may be uninsured. Thankfully, Missouri has expanded Medicaid, so more and more people have access to Medicaid in our state. But it's really important to talk about how Medicaid can really be a driver and can be leveraged for food insecurity and food as medicine initiatives. And I'm going to talk about a little bit what's going on in some other states, but also what could even be done in Missouri. And I know that there's some small projects going on throughout the state. So the key opportunity is around health related social needs. And I apologize for the acronym. I say it so much. I didn't spell it out, but that's what HRSN is. And that's another word for things that are health related social needs, which are different from social drivers of health and social determinants of health. These are ones that are health related. So if you have diabetes or if you have hypertension, you may not have access to healthy and nutrient dense food, produce, fruit and vegetables. And so that is adversely impacting it. And so there's a lot of research in underserved populations, Medicaid populations, and Medicare Advantage populations specifically, where by covering these types of medically tailored meals, medically tailored groceries, and also even just access to some of the general nutrition programs that are out there, that is actually able to help reduce health related social needs. However, it's not enough to get through the month, and oftentimes it's not long term enough. So encouraging investments in food insecurity infrastructure. So, I'm going to give you some tools towards the end of this presentation that you can take back in your community of things you could do. But we see a lot of communities and even like federally qualified health centers. I can speak of a few that we've worked with that's even started community gardens just to have access to it, or even, a food pantry in their health system or their FQHC, where they're able to have that integrated as part of their care. We actually supply several federally qualified health centers, food pantries, to be able to have those things on hand, to be able to make those kinds of decisions and like those educational opportunities while they're in clinic.
Can I
And then
ask a
it's all,
question real quick?
yeah, absolutely.
Does your organization work with rural FQHCs who have RDNs and rural health coaches for the skill development and habit changes?
So we don't do any training yet, but I'm happy to like give you best practices and things that we've seen. We are primarily, I wasn't trying to plug my organization, but we're primarily the platform for the food, and we have health coaches. So what we do see is if they don't have that in a local community, we work with them to get a grant, oftentimes through a foundation. There's also, you wouldn't believe the amount of rural health grants that are out there, that are like kind of working in the space and really wanting to address and identify evidence-based practices kind of around this. So there are funding things for that kind of work, but we don't do training yet. But we would be happy to have a conversation and go deeper with you, because our goal ultimately, we're a social impact enterprise. So we are a for-profit company, but we do work with primarily nonprofits and some health plans throughout the state. And we have seen some health plans, if you go to them and have a conversation and say, "Hey, I want to do this work," where they'll actually provide you grants. So happy to have those conversations and kind of share some of our lessons learned and what we've done. We don't have the capacity to train. That's something we want to down the road. But happy to have a conversation because our ultimate goal is health and wellness for individuals. So thank you
Thank
for that
you.
conversation. Yeah, absolutely. Thanks for the question. So, there's also an equity lens in social risk factor screening and referrals. I don't know how much of that is going on in rural communities. I know that the state has been trying to get, there's a torch program. The state is working with some rural hospitals to screen and solve and refer for health related needs, but it's only in a few pilot areas. And that's kind of really where the work is happening in Missouri at the moment. But I do know that there's an appetite with both health plans, with a lot of the foundations, like the Health Forward Foundation here in Kansas City, just unveiled basically a next 5 or so year programmatic lens around food insecurity, and trying to make it be around policy work and food as medicine type initiatives where we're able to demonstrate health impact related to food. So there's a lot of interest. I'm happy to take these offline, or I know I'll have an asynchronous chat question after this. So happy to go deeper or have a private, I'll get my email will be at the end of this presentation, and happy to have a conversation and go deeper. And then, there's also some federal and state things going on. And so, CMS has been putting forth all of these policy related memos from the federal government encouraging state Medicaid agencies to cover health related social needs, including nutrition related services, which I'll go into a minute. And so there's many states, there's over, it changes every day, but there's over 8 states that have moved forward with 1115 waivers, primarily around nutrition supports. And then there's like 7 to 8 states at any given time with pending waivers. And, I think that, I know I'm, speaking to the policy folks in the room right now at the moment, but there is a lot of amazing work that can be done on an 1115 waiver related to nutrition supports and other supports, such as housing. And I'm happy to point you guys in the right direction related to which states are kind of doing it well. Like North Carolina is a great example, that are doing a much more comprehensive. Some of the earlier states were very broad, but they weren't really hyper focused. There's some states that kind of after they've refined it, lessons learned from other states that are doing it really well, have some exciting work in this space. And then there's another area which I know that there's been an appetite with some health plans, but they, are just kind of dabbling in these conversations right now, but it's called in lieu of services. And so in lieu of services are basically the ability for a health plan to get it's basically like a state plan covered service. So it'd be for labs essentially, or wellness visit or other things that are typically covered. They're able to get these approved by the federal government. And oftentimes it's done through the state Medicaid agency in partnership with a health plan. And where they're able to get these covered, because the reason why is a lot of them are doing as value added services. But as you guys probably know, value added services with health plans are, just only able to fund a certain pilot. It's not able to provide a comprehensive, broader benefit, larger population. And the reason why that is value added services hit on the wrong side of what's called the medical loss ratio. And so there are two parts essentially to the medical loss ratio. And I'm sorry if I'm going weedy here, but it's kind of important. There's basically the medical cost, and then there's an administrative cost. And the administrative cost is everything that the health plan's paying for that's not reimbursed with a CPT code. So they may be doing care management services. They may be doing, other, like a backpack program, providing cell phones. There's a whole host of things that they may be providing, and that comes out of that value added services, as well as their profit that they're trying to make. But the medical cost, which are things that you typically see, related to, like I said, labs, X-rays, even medications are in that pot. And that is really important because that's where these in lieu of services go. And so they're able to funnel a lot of more money towards these medical costs than they are those admin costs. And so that's why it's really important, because the 1115 waivers are a little bit different. But these in lieu of services really are able to help health plans on their medical cost of their side of their benefits. I won't spend too much time here, but I just wanted to give you a snippet of what CMS has been saying related to nutrition supports, just so you can kind of see where things are going and hopefully where they're really headed towards in the future. There's case management. So there may be benefits down the road for access to food and nutrition, nutrition counseling and instruction. We see a lot of federally qualified health centers. We've seen rural health clinics. We've seen health systems really struggle how to integrate dietitians, because sometimes in certain programs they're not reimbursed, or they're only reimbursed for certain types of health conditions. And so we're seeing that CMS, through these 1115 waivers, these in lieu of services, are really broadening what can be done. But this has to go through your Medicaid agency to be able to push forward. But it's something to be talking about if this is something of interest and passion for you. That doesn't mean you can't do the work now. We're doing a lot of work in states that don't have an 1115 waiver and don't have it in lieu of services. And we're kind of making the evidence for those programs through some pilot programs, with whether it be health plan grants, health plan value added benefits, or, foundation grants or rural health grants out there. We also are seeing a lot of work around medically tailored meals. There's time limits and for how long and how many meals a day. Home delivered meals are pantry stocking. So there's ability to stock pantries. Nutrition prescriptions such as fruit and vegetables and or protein boxes is something that's emerging, and typically around 6 months. And then grocery provisions for high risk individuals. And that's where we're seeing a lot of our maternal health work is around grocery provisions for high risk pregnant moms. And that can be 3 meals a day, can be provided for up to 6 months. And I don't ask me why the 6 months. That's where some of the evidence has been, but that's what the federal government has kind of put around the parameters. And so here's what we're seeing in our early data, is that we are actually impacting preterm birth rates. And I'll go into why it's not just the food, because we're not covering it for the full pregnancy in a lot of our maternal health programs, but it's also the engagement. So we're seeing in a lot of our projects with our maternal health populations, it's a unique population to engage in their care. We're seeing most of the moms that we serve have at least one, more often times than not. So over 50% have 2 or 3 children. And, it's really stressful. Most of them are under the age of 10. And it's a really difficult time to kind of get them engaged in their healthcare. And so we've seen a lot of health systems, we've seen some federally qualified health centers, and we've seen some health plans really struggle to engage these kind of high risk moms that are at risk for preterm birth or at risk for preeclampsia, or other health conditions that may impact their mortality and morbidity. And what we're seeing is that we're actually engaging individuals with food. And so it's like addressing one of those kind of Maslow hierarchy of needs, right? Food is that one of the basic needs that individuals need besides shelter. Is when you address that, then moms can focus and prioritize their health. And I'm sure we have numerous moms on this call, and myself included, who we are all guilty of putting forth, and we're caregivers and we're nurturers, and we put everyone else before ourselves. And so, and it's no different than a lot of these moms. And so, as we work with them, we have that in mind, that this is, not something that they're able to, feel like they're able to prioritize. And so, you really have to meet people where they are. We've had to get very creative in how we engage these moms, in order to focus on their health, because it's so important for mom and baby to have healthy birth weights, having reducing preterm births. One of the other things that we've seen, is there's not a lot of programs for postpartum care. And we believe it's related to, moms were not covered oftentimes beyond that 60-day window. And so, we've kind of like taken like a concierge kind of approach, where it feels like it's a luxury. And so there's some reluctance to it. But once they get over that kind of hurdle, they're like, oh, I'm actually able to take care of myself. I feel better. I'm actually able to be better, for my baby, but also for the kids I have today. And then they're integrating actually their health choices on the kids that they're feeding as well. And so it's really important, to have cultural preferences, as we know in healthcare. It's there's all sorts of things related to food, people's choices around food, religious preferences around food, and then there's just like taste. And one of the things that we've always been pleasantly surprised is we actually have spices on our platform. And, we were always like, oh, why is there so many spices on our platform? And, and it's one of our, top requested items that people purchase. And it's because oftentimes you can't get that in a food pantry. And also, it makes food cultural for folks. And so we have such, high utilization of just spices, and that people are able to make their food culturally appropriate for them. And also, it's somewhere that they're not able to get it. So, as you're building food as medicine programs, specifically related to maternal health, but also other chronic conditions, spices can be a way to make food taste better. So some of those fruit and veggies that they may not want to eat, you can flavor them really well. And just providing access to spices will help make food taste, and more with their cultural congruity. And then also, we try to not just educate moms, but we try to educate what we call the family. So we take into consideration. So as you're doing this work or looking to do this work, it's really taking the family on. So we are even identify, even though they may not be covered, but what's going on inside the home. Does someone have diabetes? Does someone have other conditions? So that when we're, like specifying kind of the foods, as well as we do health coaching and dietitian work, what we can do to address the whole family. Because you don't just make oftentimes one meal for yourself. You make the food for the family. And then it can really impact health equity. So as you saw earlier, Black and brown moms have much more adverse health outcomes related to pregnancy. And so, it's really important to focus on some of those populations that have those disparities, as well as you saw kind of in the data, that those that are on Medicaid have higher mortality and morbidity than someone that is on private insurance. And so, really focusing on programs that can work on health equity for various populations, but understanding that food, individual is just as it's the food of one, is what we call it. Basically one person, one food program, because it has to be hyper personalized or it's not going to work. We've seen data, there's a lot of great work around, food boxes for certain conditions, but we also see that that sometimes people just don't eat it. Some of the, there's great work going around, medically tailored meals, But there's also data around saying that people are just throwing away because it doesn't taste like they want it to taste. It's not personalized based on their thing. They're just getting food delivered to them, and it has to be personalized. And then you can't have all this stuff without having access. You're not going to be able to impact maternal health outcomes, especially with those that are high risk, without having access to healthy, nutritious food. And so you have to address the food insecurity, because there's absolutely a clear link between food insecurity and chronic conditions, and we even see it more so and exacerbated in rural areas. So I'm going to hit on some approaches. I'm going to hit on these quickly because I want to save time. But like I said, feel free to email me after this if I don't get to any of your questions, as well as there will be an async as well. So I just want to make sure we cover all of the things that are kind of going on in community. So there are vendors such as ourselves and there's other vendors out there that are providing nutrient dense foods that is shipped direct to door. We have found that typically anything delivered to home is much more effective than them having to go there. And we've seen this in working with some of our federally qualified health centers. Now, if they're in the clinic and they're getting services, that does work, and it does work well, but they're less likely to come drive and pick up the food. We've tried different programs out there, and we've always seen the success when it's directly delivered to their door. And they're able to kind of choose and have the convenience of being able to pick that. And they're able to change the address of where they may be, because there may be individuals that may not have a consistent living situation. And then we've also seen great work in community gardens and farmers markets. And then there's also when there's collaboration between healthcare organizations, community-based organization, and local government to provide nutrition education and access. We've seen a lot of interesting culinary medicine things pop up where health systems, federally qualified health centers, are like working with like a local school or community college in the area. And they're actually doing cooking demonstrations just to show, hey, here's how you make it. And here's the recipes. That's something we do, is we provide the recipes. How do you prepare it? How do you store it? Even provide them little tools to store it. We see a lot of individuals that don't even have can openers, and they're getting food at a food pantry and they can't even eat it half the time because they don't have can openers. And so there's a lot of things that are just kind of things that we may take for granted, but really are kind of some of those basics to be able to be successful. And then, something that's near into my heart, you're not going to be able to have all of this great work happen without policy change. And so I think it's really important that anything you do and any of the funding you receive has a policy change and advocacy effort behind it, because that's how you're going to really get down to the systemic barriers to food access. So here are some of the community health kind of strategies. So as I mentioned, direct to door and delivery of nutrient dense groceries, meals, nutrition education programs, screening for food insecurity. I know health systems are going to have to do this more so, but I cannot underscore the importance of screening for food insecurity. Our data is so interesting and so rich related to food insecurity. And there's lots of surveys out there. There's the Prepare survey. There's also other surveys related to food and insecurity. I'm happy to provide that information to you that we survey, and you'd be shocked at how many people are fearful of being able to purchase their food for the month, or that they're going to run out in the month, which creates all sorts of kind of anxiety related to food and kind of some of those psychological issues. So I'm happy to provide any of those things to you, or any of the other stuff we're sharing. Like I said, we are a social enterprise. Our goal is to help improve community and help improve outcomes. Community gardens, as you can tell, I'm very passionate about community gardens. It's not something that's related to us, but I do believe it can do a lot of great work. So there's schools that do community gardens, there's health organizations that do community gardens, and then there's other like kind of just, civic organizations in a community that will do a community garden and can have, recipes and cooking demonstrations and all of those things that can kind of go with it. Farmers markets. We've seen some really interesting success with mobile health clinics. So as part of getting someone to come get their screenings, that you may be bringing a mobile van into a community that may lack healthcare access. Usually, if you're lacking healthcare access, you're probably lacking food access. And so, and maybe experiencing food insecurity. So you're able to provide just even produce boxes while someone's at a mobile health clinic. We've done that for several organizations, and it's been a really interesting success. And then there's food prescriptions. So, it's basically writing as if you would write a medical prescription, a food prescription to eat fruits and vegetables, and hopefully being able to provide a mechanism to address those things. As I mentioned, culinary medicine programs, partnerships with local food producers. Sometimes, local farmers may want to get involved. If you have a partnership with them, they may be able to provide you certain, vegetables or fruits that you might not be able to give. So it's just all about partnership. Telehealth can go a long way. Like, as I mentioned, dietitians and health coaching, and then policy advocacy. And so I'm going to skip some of these. These are some repetitive, but I just want to hit on a few of these. These are just a little bit of deeper details, but it's really important to get to the socioeconomic impacts that are leading to food insecurity. I can't stress that enough. Our goal is that people are food insecure. Not food insecure anymore; they are food secure. And so, education, job training, and economic development initiatives can go a long way to improving access to nutritious foods, as well as combating food insecurity. As I stressed earlier, cultural relevance increases acceptance and adherence to healthier choices. Personalized interventions is how you're going to be able to improve dietary recommendations and lead to better health outcomes. And then sustainable improvements in food are achieved through personalized experiences aligned with individual lifestyles, choices, culture preferences. And then you can't do it all without empowering behavior change. So, whether it be health coaches, whether it be dietitians, they can be supportive partners. They can help empower individuals to develop healthier eating and behavior change techniques. Understand that, better, is not, you don't have to be perfect. I think a lot of individuals that are struggling in this area related to managing chronic conditions think that they have to go wholesale overnight, and that's just too overwhelming. So, a lot of the work we do is just incremental daily steps that you can do each day to make healthier choices to, and if you fall back, and then you just go two steps forward. And so it's really about supporting individuals on their food and nutrition journey. And then I'm just going to include some resources for you so that you guys can use them in your own community. And there is a whole host of them. The links are in this PowerPoint as well. And then there's basically the Community Food Security Assessment Toolkit that's put together by USDA. And it has six components. So it's about access to food, what community resources are available, what are the community socioeconomic and demographic characteristics, food availability and affordability, and then community food production resources. And then Map the Meal is something by Feeding America, and it's an interactive map that outlines hunger at the county level. So you can go into this map and be able to see what's going on in your community. It also has food insecurity data by age group, race, and ethnicity. And then it also includes, which I think is really important, access to grocery stores and restaurants, food assistance, food prices, and other socioeconomic characteristics. So if you want to take a deeper dive and you have tools for your community, I strongly urge you to use some of these tools. A couple of the other area tools that I have is the focus area map. This is done by No Kid Hungry. This includes like percentage of students that are eligible for free and reduced lunch. And then, food insecurity and social vulnerability indexes at the county level. So you're able to go dig deeper as well with your communities. And then there's the Food Access Research Atlas by USDA. This includes healthy food stores, low vehicle access areas, and low income areas. And then the Food Environment Atlas, which is another county level data source that includes some of these others. So some of these are duplicative tools, but I just wanted to provide you some resources for you to have available to you to see what's going on in your community and see how significant food insecurity is if you may not be aware of it. So that's my full presentation. I'm happy to answer any questions with the time we have available, or happy to answer anything asynchronously as well.